So now, it is a real honor to have the opportunity for me to introduce our moderator for this morning's panel. Alison Page joined Baldwin Area Medical Center as its CEO in 2009. From 1996 to 2008, she was a member of the administrative team of fellow of Fairview Health Services. At Fairview, Alison served as the company's chief safety officer for 7 years. Prior to that, she oversaw operations of hospital and clinics in the Fairview Red Wing care system. She also has 15 years of clinical experience as a registered nurse and recognizes personally the importance of ethical collaboration among the various players in the healthcare industry. So with that, I'd like to ask Alison to come to the stage.
All right, good morning and welcome to the conference. I think we have an exciting panel for you this morning. As you know, the goal for our panel this morning is really to help conference participants better understand how the medical device industry, healthcare delivery systems, and payers can work collaboratively to really optimize the relationship and get us all focused together on the triple aim of healthcare, which is high quality of care, great patient experience, and low cost. We've had a lot of turmoil in the relationships in the past between industry and delivery systems and payers, but we think we're headed on a course that'll take us just in the right direction to help us achieve these goals. This morning, we are very, very excited to have 3 people from these industries who aren't just thinking about how we can do things differently in this country and in these relationships. They are actually doing it. They've got their boots on the ground, they're making changes, and I think we're going to have an exciting discussion with them this morning. So first, I'd like to introduce to you Dr. Richard Kuntz. Dr. Kuntz is Senior Vice President and Chief Scientific, Clinical, and Regulatory Officer at Medtronic, Inc. In this role, which he assumed in August 2009, Dr. Kuntz oversees the company's global regulatory affairs, healthcare policy and reimbursement, clinical research ventures, and new therapies and innovation functions. As Chief Innovator, and so welcome, Dr. Kuntz. Next, we have Dr. David Moen. Dr. David Moen leads Fairview Physician Associates, an integrated multi-specialty provider network built on the belief that providers are in the best position to transform care. Dr. Moen also currently serves as the Chief Medical Officer of NetClinic, a web-based program that serves as an interactive personal health portal to allow virtual care delivery involving patients and clinicians. Incidentally, NetClinic was also chosen as one of our new technology showcase companies, so be sure to visit them in Expo Hall, right back there. Wonderful. Welcome, Dr. Moen. Last, we have Dr. Craig Samet. As President and CEO of Dean Health System since 2006, Dr. Craig Samet leads one of the largest integrated delivery systems in the Midwest. Under Dr. Samet's leadership, Dean Health System has achieved a rapid transformation of its operational and strategic performance, and through delivery of better care at lower cost, has become one of the nation's leading examples of high-performing, accountable care organization. So, welcome, Dr. Samet. Okay, we expect this to be a very, very lively, interactive conversation. And as always, we expect great things to come out of the Midwest, where we have innovative technology, innovative healthcare delivery systems, and very innovative payers. So we're going to kick off with this. First, I'm going to ask each of the participants this morning to briefly introduce yourself, say a couple of words, and tell us what motivates you to do this work. Dr. Kuntz, we'll start with you.
Thanks, Alison. Good morning. Well, I think all of us are physicians, so our first commitment and goal is to the patient. I'm a cardiologist. I spent the first 20 years of my career in Boston as an interventional cardiologist, and then the last 6 years with a medical device company, Medtronic, which in its mission is dedicated to improving the quality of life and extending the survival of patients any way they can. And I think this is a good fit for me personally in extending another way as a physician to try to harness science and technology and try to provide solutions for patients who continue to suffer, especially from chronic diseases. So that's in a nutshell.
Okay, great. Dr. Moen?
Good morning. I'm actually got into this because my background in emergency medicine, I was really recognizing that most of what I was doing actually was not treating patients with emergencies. And there's a huge disconnect in the way our patients actually experience their care and what they really need. And I began to really think about the fact that we need to transform our system to a much more patient-centered system, and we need to get really honest with ourselves as clinicians about what we're doing today that isn't working and lead toward a better system.
Okay, Dr. Samet?
So good morning, everyone. I would blame my movement to the dark side, so to speak, to get into the business of healthcare on the Clintons. I was actually a medical resident in Boston when the Clintons were in office and they were reforming. Hillary Clinton was seeking to reform healthcare the last time around, and my frustration was it didn't seem as if we were actually controlling our own destiny in reforming healthcare, and so I chose to go to business school instead of continuing clinical medicine. The wake-up call for me in business school was as I listened and heard and was taught about the best companies in the world. In my 2-year tenure, not once did I hear a case describing a healthcare company. And so the reason I do what I do is I feel there's tremendous opportunity for us to reform healthcare from within as opposed to it being externally imposed. And I've dedicated my career to really helping create the first example of an integrated delivery system or a healthcare company that sets a gold standard, not just within healthcare, but to other industries as well.
Okay, thank you very much for those introductions.